This is Mridula Kapil, a regular college girl. She's outgoing, friendly, passionate about dance, sport, and completely obsessed with her nail art. You wouldn't know by the looks of her, but she has been a diabetic for most of her life. Like many diabetics, she has learned to adapt and live as normal a life as any. And new technologies such as CGMS and insulin pumps have made this easier than ever before.
I was diagnosed with diabetes in the year 1994. It's been 19 years. At that time I was 4.5 or 5 years old. In the starting I was like, मेरे को injections क्यों लेने पड़ते हैं? Childhood में सब जो है injections से डर रहे होते हैं, and I used to take injections. It was like very, क्यों मैं ही क्यों? Why me only?
Knowing that you have diabetes can be scary, and if the disease is not managed well, it can lead to blindness, kidney failures and even heart attacks. But it must be remembered that knowledge is power, and with the proper knowledge and care, people with diabetes can live a long and healthy life just like Mridula.
One of my patients, Mridula, she's a type 1 diabetic for last 1.5 years. The problem with her was that she had wide fluctuation in the blood sugar, which used to basically interfere in her lifestyle. She was basically totally bound with a particular kind of food, stopped going to the parties, most of the time remains depressed because she can't attend parties, she can't go to the shopping because of the wide fluctuation of the blood sugars.
Instead of losing hope when faced with the disease, like so many others, Mridula decided to fight. And technological advances such as insulin pump coupled with continuous glucose monitoring system or CGMS delivers insulin more accurately than daily injections. And these are allowing people with diabetes to manage their sugar levels much more effectively. These tiny devices have helped Mridula take a better control of her sugar levels and her life. Now she no longer has to take multiple daily injections for testing her blood sugar and is successfully able to avoid wide fluctuations in her sugar levels. And the best part is that with the insulin pump, she is able to lead a normal life like other children of her age. And this has helped her regain her confidence.
पहले तो थोड़ा सा लगा था कि ये थोड़ा सा एक ऐसी चीज़ है कि मैं इसे लेकर घूमना पड़ेगा. People will ask me what is this, और कभी कभी काफ़ी जैसे लोगों को मैं बताती हूँ कि आई एम अ डायबिटिक पेशेंट, तो दे कॉल मी ओ पुअर गर्ल, ओ पुअर बेबी. आई एम नॉट लाइक पुअर. व्हाई एम आई पुअर? आई एम नॉट पुअर. इट्स लाइक ओके, आई एम डायबिटिक. ऐसा कोई भी चीज़ नहीं होती है कि मैं कुछ नहीं लेती हूँ. द थिंग इज लिमिट एक होनी चाहिए जो आप ले सके अपने फ्रेंड सर्कल में बैठकर. सो अगर कोई पिज्ज़ा ले रहा है तो ये नहीं होना चाहिए कि मैं डायबिटिक हूँ और मैं दूसरों को बताऊँ, या फिर मेरे फ्रेंड्स सोचे कि ये डायबिटीज है इसे, तो इसे रहने देना चाहिए पूछने के लिए. इंसुलिन पंप के साथ ये प्रॉब्लम जो है मेरे को सीरियसली लगता है कि इसमें वो आया है इम्प्रूव.
इंसुलिन पंप इज अ स्मॉल इंटेलिजेंट डिवाइस which deliver insulin at a pre-programmed rate and also according to the need of the patient. When the patient eats either breakfast, lunch or dinner, it is programmed to deliver extra insulin during that time. Apart from that, it delivers a constant rate of insulin throughout the 24 hours of the day so that blood sugars are maintained within the normal range.
An insulin pump is the most effective physiological method of insulin delivery, and unlike injections, it closely mimics the functioning of the normal pancreas. It delivers a rapid-acting insulin in programmable doses through a soft tube under the skin. The insulin pump gives diabetics freedom from daily injections, and besides delivering basal rate insulin 24/7, it also delivers programmed doses of insulin after every meal to the patient.
The other insulin basically are given at a short fixed intervals, so which just covers the breakfast, lunch and dinner, and in between, other than the meals, we are not able to cover the blood sugar fluctuations. So as compared to the pump, the conventional deliver the insulin does not maintain the blood sugar within the specified normal range throughout the day. So there are peaks and valleys, ups and downs when the patient is on conventional insulin injections.
While insulin pump is one of the best methods of delivering insulin, this coupled with continuous glucose monitoring system or CGMS can work wonders for diabetics. CGMS measures glucose levels 24/7, recording a new value every 5 minutes. It helps keeping track of blood sugar levels and other patterns that would otherwise be missed. Dr. Amrish Mittal, an expert on diabetes management, sees CGMS as a welcome addition in the field of medicine.
CGMS is a method by which we monitor blood glucose continuously. Like when you go to the lab or use a glucometer, you check a 1-point blood glucose. In CGMS, you get a continuous recording of your blood glucose over 2 or 3 days. So, in other words, a little bit like a holter of the blood sugar. You do a holter for the heart, where you record the heart rhythm for 24 hours. In this, you record the blood glucose levels for up to 72 hours continuously.
Mr. Singh, who has been suffering from diabetes for the past 25 years, found it very difficult to keep his blood sugar levels in control. Despite regular finger prick monitoring, medication and insulin injections, his blood sugar levels were usually high. He was recommended to undergo CGMS monitoring by his doctor, and this is what Mr. Singh has to say.
CGMS की रिपोर्ट के बिहाफ के ऊपर जो डॉक्टर ने मेरी इंसुलिन की डोज फिक्स की है, उसका जो कुछ दिनों में मेरे को फ़ायदा महसूस हुआ, वो 25 साल में मेरे को दवाई से महसूस नहीं हुआ. तो मैं कुछ दिनों से जो इंसुलिन ले रहा हूँ, इससे मैं अपने आप को बड़ा एक ठीक महसूस करता हूँ.
After going on CGMS, Mr. Singh realized that his blood sugar levels saw erratic highs and lows. After getting the exact information on his sugar levels, the doctor prescribed his daily dose of insulin, which is making Mr. Singh feel like never before.
CGM is a very useful tool for certain kinds of patients. Patients where we suspect that they may be getting low blood sugars at night and they may have no symptoms. That's one group where it's important. Another group is patients who tend to get very sharp rise in blood glucose after eating and then falls again. And this sharp rise will be missed unless you check blood glucose at that time itself. That's the second group. The third is where the patterns are totally bizarre, where you just can't figure out. As a doctor, you cannot figure out what is happening. Sugars are fluctuating all over the place. You don't know when it's going high, when it's coming low. That's another important group. See, when we treat diabetes, the aim of treatment is to keep blood glucose as close to normal as possible. Now, there was a time when the tools we used were fasting blood glucose done in the laboratory once a month. That is one extreme. Then there came a time when we started using self-monitoring of blood glucose, which is very useful, where we can monitor with the finger prick method many times blood glucose in a day. But there are many fallacies to that. And CGM, by virtue of giving a 24-hour profile, helps us to really fine-tune the treatment. It also helps in another way, not just with our adjustment of insulin or medication. It also helps in showing the patient which particular food item actually changed the blood glucose. So many times where patients are surprised when they say, oh my God, it went up so high because I ate XYZ, So I think it serves a very useful tool in fine-tuning diabetes management to achieve really optimum targets for our patients.
CGMS is very simple to use and the patient can go about their routine activities like swimming, exercising, etc. as the device quietly and constantly measures the blood sugar levels. Once attached to a patient, the device maintains a precise record of blood sugar levels and continues monitoring up to a period of 72 hours, thereby ensuring that not even a single spike or dip goes unnoticed.
CGM and self-monitoring of blood glucose by glucometer are complementary tools. Self-monitoring is done on a day-to-day basis regularly. CGM is done maybe once in 3 months, once in 2 months to make sure that with self-monitoring we are not missing that. In terms of its actual benefits, there is no doubt that controlling diabetes better, like reducing the fluctuations, avoiding nocturnal hypoglycemia, you can't even quantify the benefits. So really looking at long-term benefits of reducing complications, you're looking at short-term benefits of reducing the problems that may occur with low blood sugar. So I think it is definitely cost-effective in the given clinical situation.
With such a thorough understanding of sugar level fluctuations and their body's insulin requirements, patients like Mr. Singh and Mridula no longer live in fear of an imminent attack. Mr. Singh, Mridula and many more such patients with their trusted insulin pumps tucked into their pockets now go about their lives with comfort and ease.
I just want to ask the doctors about CGMS.
The most important part of this CGMS is that those patients who can't recognize the symptoms of low blood sugars, what in medical terms we call it hypoglycemia. There are certain children in particular, those who get hypoglycemic unawareness, where the classical symptoms of low blood sugars are lacking, and during the midnight or during the night the sugar may dip down as low as 40 milligram without the knowledge of the patient, and in the morning when the patient does the blood sugar, it is high because of the extra glucose production in the body. In order to detect what we call this dip in the blood sugar during the night, or when the patient does not get symptoms, hypoglycemic unawareness, CGMS is like a boon to the patient. In that case, we can exactly modify the dose of the insulin, which the patient cannot do without knowing every 5 to 10 minutes what the blood sugar in the body behaves. And that is why when we do the CGMS, we download the data after 72 hours and the data comes in the form of the curves. And downloading the data just takes the help of a small laptop. We have a software attached to the laptop and we can download all the data of the previous 3 days to know exactly the blood sugar fluctuation.
मेरे हस्बैंड डायबिटीज़ पेशेंट हैं और ज़्यादा सीवियर नहीं है, तो CGMS से क्या फ़ायदा है?
It has been shown scientifically that even the small variation in the blood sugar, minute to minute, hour to hour, directly affects your blood cells in the body, what they call the blood vessels, and that is directly responsible for the complications related to your heart. And it has been shown there is a direct correlation between the sugar fluctuation, or in medical terms what we call glycemic variability, day-to-day fluctuation. It directly impacts your heart function, and these patients are more prone to develop heart disease as compared to those patients where their sugars may be normal, but they are not aware of the fluctuation throughout the day. Even the sugar, they thought their sugars are absolutely okay as compared to other patient who is also having normal blood sugar, but he is having small variation in the blood sugar as compared to other patient who has got wide variation during the day. And we know that the variation affect our heart. So this is important why CGMS is so important in everyday's life of a diabetic patient, in particular for the children, those who are on multiple daily injections of insulin.
Can insulin be harmful for the human body?
One of the most common myths about diabetes is that insulin therapy is the last resort of a diabetic, and insulin therapy has tremendous side effects and should be avoided at all costs, and I think that is costing us a lot. I think insulin therapy is very important in diabetes. It should be used wherever it is required. It is not always permanent. It is not irreversible. It is not the last stage of diabetes. And if insulin is helping you control your diabetes better, insulin is the safest mode of treatment. Remember that in non-diabetics and normal people, how is the sugar level controlled? It is controlled by the insulin made within our body. So when you're giving a natural body substance from outside, it is always safe. So the myths about insulin therapy are very important, that they're broken. Otherwise, people delay insulin therapy unnecessarily and end up with all kinds of complications.
What are the common myths about diabetes?
Patients often feel that they give up sweets and that's the end to a diabetic diet. A diabetic diet is a healthy diet for everyone. And within a controlled amount, even sweets can be permitted. So there is very little difference between what we say is a healthy diet for general population and a healthy diet for a diabetic. So it's important to remember that you need all the nutrition in your diet, the correct amounts of nutrition, and giving up one or the other food item will not really help you in treating your diabetes. There's also a myth that, to reduce calories, lose weight, control sugar, I didn't eat, I missed a meal. Missing meals is one of the worst things you can do if you're a diabetic patient, especially if you're on medication. It's important to eat on time. Eating on time is as important as eating the right thing. So you have to balance both. You have to eat a healthy diet and you have to eat the diet on time.